After 60, the way you sleep is either protecting your body or quietly damaging it. And one of the biggest mistakes people make is assuming their sleeping position doesn't matter. Before I name the position, you need to understand one thing, because once you understand this, you will never look at your bed the same way. After 60, three things changes in your body and they all converge on one reality. First, connective tissues. A 35 years old can sleep on their stomach, wake up, stretch once and move on. A 70 years old with even mild spinal arthritis sleeps on their stomach and wakes up with neck pain that lasts until noon. Second, the condition that become more common with age. Sleep apnea affects a significant portion of adults over 65, most undiagnosed. Acid reflux affects nearly half of senior arthritis, spinal stenosis, bursitis. All of these turn your sleeping position from a neutral choice into something that can either manage the condition or make it worse every single night. Third, the sleep itself changes. We spend less time in a deep restorative sleep as we age. That means every hour you are in bed more precious. Bad position that just made you a little stiff at 40 now robs you of the deep sleep. Your brain needs to clear waste products linked to cognitive decline. Number 1. Sleeping flat on your back, lying completely horizontal, one pillow, arms at your side. And I know this surprises people because for decades we were told back sleeping was the healthiest position. For younger person it often is. For someone over 60, the math changes. When you lie flat, gravity pulls your tongue and the soft palate at the back of your throat downward. They collapse backward, narrowing your airway. For someone with even mild sleep apnea, studies suggest a large portion of adults over 65 have at least moderate sleep disordered breathing. This position multiplies how many apnea events you experience per hour. An apnea event is when your breathing partially or completely stops. 10 seconds, 20 seconds, your blood oxygen drops, your brain sensing danger jolts you partially awake to restart breathing. You don't remember it in the morning, but it happened maybe 30 times, maybe 50 every single night. So now let me connect. Untreated sleep apnea in senior is associated with significantly higher risk of stroke, atrial fibrillation, and drug resistant hypertension, meaning your blood pressure medication work less effectively because what's happening while you sleep. There is also growing evidence that not getting enough oxygen during sleep may contribute to faster cognitive decline. This is not small stuff. How do you know if this is you? Three signs. One, your partner tells you that you snore loud and sometimes they notice you stop breathing, then gasp. Two, you wake up with dry mouth or a morning headache that fades as the day goes on. Three, you feel unrested despite what should have been a full night's sleep. If any of those sound familiar, flat back sleeping is likely making it worse. Now, the fix. The fix is straightforward. Elevate your upper body to roughly 30 degrees. You can use a wedge pillow. They are inexpensive and widely available, or an adjustable bed. The key is that the elevation starts from your mid back, not just your neck. Stacking regular pillows creates a sharp bend at your neck, which can actually make breathing and reflux worse. You want a gradual slope, then place a pillow under your knees. This shifts your pelvis backward, helping your lower back rest in a more comfortable position. That takes pressure off irritated joints and allows your spine to relax while you sleep. The first night on an inclined pillow will feel different. So that's normal. Give it 3 nights. By then, many people notice they are waking up with less morning drowsiness and fewer headache. Position number 2, stomach sleeping. And I want to be direct with you. Of all 5 positions in this video, this is the one I strongly recommend you to stop completely after. I understand the attachment. Some patients tell me it's the only way they can fall asleep. It feels grounding, pure, almost like a weighted blanket. Others have done it for 40 years and their body simply doesn't know another position. I had a patient, 72 years old, came to me with tingling in her right hand and chronic neck pain. She had been to a neurologist, had an EMG, electromyography, was told it might be a carpal tunnel. But when I asked her how she sleeps, she said, on my stomach always have. The tingling wasn't her wrist, it was her cervical spine. The nerves existing between the vertebra in her neck were being compressed every night by the sustained rotation. Your head must be rotated to one side. You can't breathe through a pillow. Over time, this leads to the cervical radiculopathy, nerve compression that sends pain, numbness, or tingling down your arm, cervicogenic headaches that start at the base of your skull, and chronic muscle guarding that pulls your entire posture out of alignment. Simultaneously, your lower back arcs into hyperextension. Your lumbar vertebra and discs between them are compressed posteriorly. If you have a spinal arthritis, facet joint hypertrophy, or disc degeneration, you are essentially pressing into the most sensitive structures in your spine for an entire night. And then there is a breathing. Your chest is compressed against the mattress. Your diaphragm, the primary muscles of respiration, has to work against the resistance with every breath. You are not suffocating, but your breathing becomes shallow, less oxygen to your brain, less oxygen to your heart muscle every single night. So how do you change it? This is the practical part. Week 1, start by falling asleep on your side with the body pillow hugged against your chest and a firm pillow between your knees. You will likely wake up on your stomach. That's fine. Your body has decades of muscle memory. Every time you wake up and find yourself on your stomach, simply roll back to your side. Don't get frustrated, just reposition. Week 2, your body start adapting. You will spend more of the night on your side. Week 3, side sleeping begins to feel natural. By week 4, most patients report they are no longer waking up on their stomach at all. The body pillow is essential. It gives you that same sense of something against your front that stomach sleepers crave. The knee pillow keeps your hips aligned so your spine is not twisted. Together they create a cocoon-like position that becomes more comfortable than stomach sleeping once your body adjusts. Position number 3 is different from the first two because side sleeping one of the healthiest position for seniors. It keeps your spine neutral. It naturally helps keep the airways more open than back sleeping. Research even suggests it may improve the brain's glymphatic clearance, the waste removal system that active during sleep. But which side you sleep on changes everything. And if you have any degree of acid reflux, this single detail can matter more than just your medication. Your stomach is positioned mostly on the left side of your abdomen. The esophagus connects to it from above, with the lower esophageal sphincter acting as one-way valve. When you lie on your right side, the stomach is physically positioned above the esophagus. Gravity pulls acidic stomach contents backward through that valve. Even if the valve is functioning well, the combination of gravity and the body position can overcome it. The result, acid reflux at night. For many seniors, this doesn't feel like classic heartburn. It feels like waking up with a sore taste in your mouth, or a dry cough that would not go away, or a sensation of something stuck in your throat. This is what we call silent reflux, laryngopharyngeal reflux. The acid travels all the way up to the throat and larynx, causing irritation without the typical burning sensation in chest. Over time, silent reflux damages the delicate tissue of your esophagus and throat. It erodes the protective layer of your teeth. It disrupts deep sleep even if you don't fully wake up. The acid exposure triggers microarousals that pull you out of restorative sleep stages. Now flip to your left side. The stomach sits below the esophagus. The natural curve of stomach creates a pocket that gravity works with, not against. The acid pools in the lower portion of stomach where it belongs. Studies have repeatedly shown that sleeping on your left side significantly reduces acid exposure at night. In some researches, more effectively than over-the-counter antacids alone. Now, let me add something important. Meal timing amplifies this. If you eat a large meal and then lie on your right side within 2 to 3 hours, you are combining a full stomach with the worst possible position for reflux. The fix is simple but powerful. Finish your last meal at least 3 hours before bed, then sleep on your left side. Those two interventions together, timing plus position, are often more effective than either one alone. And one transition tip: if you have been on a right side sleeper your whole life, switching can feel disorienting at first. Put a firm pillow behind your back. It prevents you from rolling right during the night. Some patient starts in a half left position, not fully on the left side, but tilted about 45 degrees with a pillow wedged behind their back. After about 2 weeks, full left side sleeping feels completely natural. Position number 4: the tight fetal position. Let me walk you through this because the damage accumulates in layers, and understanding those layers in what will motivate you to change. First, your hip flexors. These are deep muscles at the front of your hips that help control posture and movement. When you pull your knees to your chest, these muscles are in shortened position. Now, consider this. If you are like most seniors, you also spend a significant portion of your day sitting in a chair, in a car, on a couch. Sitting also shortens your hip flexors. So, you are now at 12 to 16 hours per day of hip flexors shortening. Over months and years, these muscles adaptively shorten. They pull your pelvis forward, which pulls your lower back into an exaggerated arc when you're standing, which contributes to the stop forward leaning posture that becomes harder and harder to correct. Second, your spine. When you curl tightly your vertebral discs, the shock absorbed between your vertebrae are compressed anteriorly and stretched posteriorly. Discs get their nutrition through movement, through changes in pressure that pumps fluid in and out. When you stay in one extreme position for 8 hours, those discs don't get the pressure cycling they need. Over time, this accelerates disc degeneration. For someone with osteoporosis and osteopenia, that sustained forward flexion can contribute to vertebral compression fractures, tiny cracks that accumulate silently and lead to the progressive height loss, and hunched posture called hyperkyphosis. Third, your breathing, your thighs pressing against your abdomen combined with curled torso physically restrict how far your diaphragm can descend. You are breathing at partial capacity, not enough to feel short of breath, but enough that your blood oxygen levels are lower than they should be during the restorative sleep stages. Fourth, your neck. When your chin is tucked to your chest, the front of your cervical discs are compressed and the structures at back of your neck are stretched. This can trigger cervicogenic headaches, headaches that originate from neck but are felt in the head. Now, here is something I want to connect. Tight hip flexors from the fetal position contribute to a forward center of gravity. When you are standing and walking, your body compensates by rounding your upper back. This altered posture affects your balance, and balance is quite literally a life saving capability after 60. Falls are leading causes of injury and loss of independence in seniors, and your sleeping position is one piece of that puzzle. The fix, what I call loose side sleeping: lie on your side, knees only slightly bent, about 20 to 30 degrees, not pulled up. Place a firm pillow between your knees. This prevents your top leg from rolling forward and twisting your lumbar spine. Hug a pillow against your chest. This supports your top arm so your shoulder doesn't collapse forward. Your spine should form a relatively straight line when viewed from behind. Two quick morning stretches that help undo the overnight curl. 1. The kneeling hip flexor stretch. One knee down, one foot forward. Gently press your hips forward until you feel a stretch at the front of kneeling hip. Hold 30 seconds each sides. 2. The doorway chest opener. Stand in a doorway, arms out to the sides on the door frame, and gently lean forward until you feel a stretch across your chest and the front of your shoulders. These two stretches, done every morning, help reverse the shortening that the fetal position creates overnight. Position number 5 is different from others, and I want to be very clear about this before I say anything else. If you are sleeping in a recliner every night, I know you did not choose this. You arrived here because your lying flat became too painful, or your reflux was unbearable, or you are recovering from surgery. This position comes from necessity, not habit. But here is what I need you to understand. The recliner is bridge, not destination. And there are things happening to your body during those recliner nights that you may not be aware of. First, circulation. The semi sitting position, torso elevated, legs dependent, hips bent, creates a pulling effect in your lower legs. Your veins are trying to return blood to your heart against gravity, and the angle of recliner makes that harder. If you have noticed that your ankles or feet are swollen in the morning, that's venous stasis, fluid pooling because circulation is compromised. For someone who is already less mobile during the day, this increases the risk of deep vein thrombosis, blood clots in the legs. The warning signs to watch for: one, cough that's more swollen than the others, warm, redness, or tenderness. If you notice those, that's not a wait and see situation. Second, spinal decompression. Your intervertebral discs, the cushions between your vertebra, lose fluid during the day under the compressive force of gravity. At night, when you lie flat, that compression is removed and the disc rehydrate and expand slightly. This is how your discs stay healthy. In recliner, your spine never fully unloads. The disc never get that full rehydration cycle. Over weeks and months, this contributes to the slow progression of the disc degeneration, and the back pain that drove you to the recliner in the first place can actually worsen. Third, sleep quality. In recliner, your postural muscles, the muscles along your spine that keeps you upright, remain partially engaged all night. Your body never fully lets go. You may think you are sleeping deeply, but studies on sleep position show that semi-reclined sleeping reduces time spent in a slow wave sleep, the deepest, most restorative stage. You are spending more time in lighter sleep stages, which means less tissues repair, less hormone regulation, less cognitive restoration. Fourth, and this is the one I think matters most when I talk to the patient: emotional adaptation. Sleeping in a recliner night after night becomes a quiet admission that your body is failing you. It separates you from your partner if you share a bed. It normalizes the idea that pain is permanent. I want to hear me. Pain may be present, but that doesn't mean the recliner is the only answer. Here is how to move back to a bed. Step 1. Identify what's keeping you in a recliner. Back pain, reflux, shortness of breath, hip pain. Be specific. Your bed setup should match the problem. Step 2. Set up your bed accordingly. If it's back pain or reflux, elevate your upper body and support your knees. If it's hip pain, use a side sleeping setup with a firm pillow between your knee and a body pillow for support. Step 3. Transition gradually. Week 1. Start the night in bed. If you wake up uncomfortable, move to the recliner. Week 2. Try to spend the whole night in bed. By week 3, the bed should feel like primary sleep location again. If you are using the Recliner for recovery after surgery or an injury, follow your doctor guidance. But ask, when can I start moving back to a bed? The goal is to make the Recliner temporary, not permanent. Here is the single most important thing I want you to take from this. Sleep is supposed to help your body recover. That's its job. After 60, the way you sleep matters more than most people realize. The wrong position can put stress on your joints, your spine, your breathing, and even quality of your sleep. So think about position you spend most of the night in. If you sleep flat on your back, elevate your upper body and support your knees. If you sleep on your stomach, start working towards side sleeping. If reflux is an issue, sleep on your left side instead of right side. If you curl into a tight fetal position, loosen it and support your body with pillows. And if you are sleeping in recliner every night, start planning your way back to a bed. Don't try to change everything together. Pick the one position that sounds most like you. Make one change, stick with it for 2 weeks, then pay attention to how you feel. Which of these positions do you sleep in? Let me know in the comments. And if you found this video helpful, subscribe for more practical health advice. Thanks for watching. Sleep well, and I will see you in the next video.